Dr. Sajid here again. This is in response to a question that I was asked about breastfeeding. Breastfeeding undoubtedly is the best form of nutrition for not only newborns but during the first few months and all the way to 2 years of age. It is the normal way of feeding a baby. It's the natural way of feeding a baby. It provides for bonding between the mother and the baby, and it is always available to the baby at a temperature that is easily digestible, and it is always safe and free from contamination. Besides these qualities, the most important aspect is that it provides proper and complete nutrition. Now, when we talk about nutrition, we talk about carbohydrates, proteins and fats. It provides appropriate quantities of carbohydrates, especially the sugar that is easily digestible. It provides for proteins, and the ratio between the proteins that are available is such that it is trouble-free for the intestines, in the sense that it doesn't cause any discomfort. And so is the fat. It also has some vitamins and has a certain quantity of iron, so that you do not have to supplement, with the possible exception of vitamin D, which we routinely give to breastfed babies. The other advantage that it has is that it provides immunity, that is resistance against infection, and that is provided by cells and protein that are contained in the human milk that are provided by the mother. Also, babies who are breastfed will have less of a chance of infections that are so common in children in our countries. And the two kinds of infections that are very common are that of what we call the respiratory system, coughs, colds, etc., and of the intestine, such as diarrhea, passing of loose stools, etc. So it provides immunity, also provides immunity against allergic diseases and other diseases of the intestine. Now, I've mentioned bonding, I've mentioned benefits for the baby, but there are benefits for the mother also. The mother, if she is feeding, will go back to her normal body proportions quicker, and her uterus, which carries the baby, will go back to the normal size much quicker. Also, there is evidence that by breastfeeding, the mother will also decrease her chances of trouble later on in life, including some cancers, perhaps of the breast and of the ovaries. So, what is the best way or the best time to breastfeed? Certainly as soon as possible after birth, certainly within the first hour. It doesn't come right away, and so a mother has to be relaxed. She has to be well fed and well nourished. She has to be well hydrated. You don't need to drink extra milk to produce milk, but you should be well hydrated, and you should have a very positive attitude. So if you try, it will take a day or two, but milk flow will come, and it will always work. There are very few contraindications. You can say almost none. And if you think that there is reason for you not to breastfeed, then you have to check with your doctor. I think it is sometimes tough on mothers to start breastfeeding immediately, especially if the decision is taken at the operating table or in the delivery room. So the decision to breastfeed should have been taken much earlier, after discussion with the obstetrician, and if at all possible, not only with the family but also with the pediatrician, so that the mother-to-be is prepared to breastfeed and understands the benefit of this great form of nutrition. So my plea to most mothers to be, and mothers who already are mothers, is to breastfeed, because it is a complete form of nutrition. It provides a lot of protection, it provides a good source of nutrition, and you should breastfeed your baby exclusively for the first 6 months at least, to ensure that your baby stays well physically and mentally and bonds well with the mother.